Cancer. Nearly everyone has someone in their life who has been impacted by cancer. Almost 40% of people will be diagnosed with cancer at some time in their life, and it is the second leading cause of death in Illinois. Each year, the Cook County Health and Hospital System treats 10,000 cancer patients, including 1,700 who have been newly diagnosed. The health system treats a wide array of cancers, and the most common include breast, colorectal, lung, and prostate cancers. Cook County Health and Hospital System's healthcare providers, including Dr. Elizabeth Marcus, a surgeon and chair of breast oncology, provide expert services for cancer patients across the continuum of care.
Here at the Cook County Health and Hospital System, we actually provide every service imaginable, and we deliver it in a multidisciplinary environment.
As a safety net health system, Cook County Health and Hospitals treats some of the most serious cases of cancer in the region, and that requires specialized person-centered care.
I think the one thing that's really unique about our system is how many of our patients come in more advanced states of disease. One of the things that you really learn about taking care of patients by being here is that you have to take care of the whole patient. Unless you take care of those things that kept them from getting here, they're not going to get the benefits of the advanced treatments that we offer.
After first being diagnosed with breast cancer more than a decade earlier, Jackie Elrod found a lump in her breast just a couple of years ago. Her daughter talked to friends in the healthcare field who recommended Jackie see the breast cancer specialist at Stroger Hospital.
I needed to get somewhere since I had found it, so I said, okay. And that was the best decision that I could have ever made. It was the warmth and the assurance and the fact that I was going to be okay, you know, with them. If anybody in the world ever had found a breast tumor, please find Dr. Elizabeth Marcus and Kathy Power at Stroger. I would never go anywhere. I would never go to another hospital but this one.
Cook County Health and Hospital System offers its patients the highest quality of cancer care, from advanced chemotherapy to best-in-class surgical care and highly targeted radiation therapy. This includes treatment with 2 new cutting-edge linear accelerators that provide ultra-precise radiation to cancer cells and minimize damage to healthy tissue. The health system's cancer committee, chaired by Dr. Urjit Patel, makes sure that the care provided by the system is among the best in the country. The committee collaboratively reviews every patient's case and creates a comprehensive treatment plan tailored to each individual patient.
What I'd like people to know is that we provide excellent state-of-the-art cancer care for our patients, and stage per stage, our outcomes are on par with any other major academic institution.
The health system offers its patients unparalleled access to clinical trials designed to improve outcomes and reduce cancer disparities. Since 2002, more than 1,100 patients have been enrolled in cutting-edge clinical trials.
I remember one patient in particular. He had undergone a biopsy at an outside hospital, but because he didn't have insurance, they were unable to actually provide the cancer treatment that he needed. Accordingly, they sent him to Stroger's emergency room, where he presented simply with a sheet of paper telling us what kind of cancer he had and to go ahead and treat him. As of today, he's doing great. After coming into the emergency room at Stroger, we enrolled him on a clinical trial where he received chemotherapy and radiation therapy, and he remains disease-free.
For Executive Medical Director Dr. Claudia Fagan, the cancer program highlights the health system's mission to care for all in need.
The care that we provide to patients with cancer is really quite outstanding. And regardless of why they come to us or how they find their way to us, we provide them some of the best care that they can find.
Jim Davis first came to Cook County Health and Hospital Systems after he couldn't afford the follow-up care at another hospital.
My first kidney cancer in 1997, I was referred after surgery for follow-up care, but I couldn't afford the follow-up care. It averaged $500 or $600 a time, and I just didn't have that kind of money. So I had to quit getting follow-up care. If it wasn't for Cook County Hospital, I wouldn't have been able to get the care I needed. One thing I like about Cook County especially is that it's a teaching hospital. They didn't just give me the surgery, they checked on other conditions and gave me like a tune-up. They give you excellent care, and they take care of everyone.
As a physician who trained at Cook County himself, Dr. J. Shannon, the Cook County Health and Hospital System CEO, knows just how important the health system is to its patients and to the education of the next generation of doctors.
The health system plays a critical role regionally for the care of people who have cancer. Cancer is the classic condition that requires long-standing, complex, multidisciplinary care. Because of the volume and the diversity of patients that we care for, we are a critical training ground for tomorrow's cancer specialists. We are probably the place that more cancer specialists have trained than any other in the city.
Cancer can be a devastating diagnosis, but the health system is there for its patients every step of the way, as it has been for more than 180 years. From diagnosis to treatment to recovery, patients can count on Cook County Health and Hospital System for expert care.